So what I'm going to talk to you today about is digital interventions and how they might be able to be used to enhance recovery, promote precision treatment, and to support well-being. So Maria shared with you a short overview of what I'd be talking about, and you will have seen in the program something about the overview as well. And really what I want to concentrate on is the way that across the world, with particularly COVID-19, we've had to pivot all of our healthcare delivery very quickly using technological solutions, using digital interventions. And so that has been a real challenge for the whole world. And in fact, there was a meeting not so long ago that was published in the Lancet, the digital Lancet, and it was called the Ryder Declaration on Digital Health. And so there was a global meeting to discuss the need to be able to pivot healthcare and to ensure that there was good quality coverage for digital health around the world and high quality sharing. And I'll share with you a couple of the points that they wanted to encourage us to take on board in a moment. But one of the really important factors that came from this piece of work was pointing out that on average, it can take about 17 years to translate a major medical research discovery to widespread delivery. Now, that's a very long time, and that's not going to help us with a pandemic that is moving very rapidly. So we need to be able to work in a much more rapid space when it comes to digital health. And you know, some of the factors that are shaping that is the competitive commercial culture of technology that really revolves around disruptive innovation and iterative discoveries and the delivery of new technologies. And that happens over months, not years. So this is shaping a very different way for us to consider the health needs of the world. Here are some of the recommendations that arose from the Ryder Global Digital Health Summit. And I would like to particularly draw your attention. There are 9 recommendations, and I would like us to focus on just a couple of them today. So in particular, recommendation 6 says that we should work towards cultivating a health and care workforce with knowledge, skills, and training in data and digital technologies required to address current and future public health challenges. And then recommendation number 8 suggests that developing digital personal tools and services to support comprehensive health programs globally is going to be very important. So these are a number of driving foci for us as we consider digital health and the needs of world health, global health in today's climate. Are you able to see my slides yet? Excuse me. No?
No, in fact, and I don't have it with me, Rhonda, you didn't share, but it's okay, just, that's all right.
Okay. There will be some slides that will come after this as part of the package. So I wanted to talk to you a little bit about support and well-being and how digital interventions might be able to be utilised to support well-being for people with a range of health problems. And in fact, just today, we had a publication released in Issues in Mental Health Nursing. And it was a narrative literature review about the use of digital interventions. Sorry, Sylvia, did you want to say something? No. digital interventions to address menopause in particular, and the psychosocial discomforts that might be found in menopause. So this is a project, an international project that we've been working on for several years, and Maria has joined me on that project, and we have colleagues in Australia, Finland, but also in New Zealand and the UK. And it has been a really interesting journey with this particular study, which actually started with a literature review aiming to explore if digital technologies and digital interventions were being used at all to support women through menopause. And when we looked at the literature, we looked at the literature across 10 years, from 2010 to 2020. And we actually discovered that there was very little literature. In fact, in terms of evidence-based and peer-reviewed research literature, we found less than 5 articles. And we were really surprised about that. And it made us start to think, well, you know, this is a life course, a life event for half of the world's population, theoretically. And it may well be that digital technologies have something to offer to support women through that period of time. And what we do know about women and the use of digital technologies is that they have found e-health strategies to be very useful, particularly in terms of virtual consultations, therapies, and a range of strategies. So our literature review was able to highlight there were some major issues for professional women who experience the psychosocial symptoms of menopause, and there were digital health strategies that can be used to support women. And what was very interesting was that we were able to raise some awareness around the intersect of women's health, mental health, digital health, and occupational health. And so we thought it was really important to find new ways to support women where they might have a digital intervention that was flexible, convenient, and discreet if they were seeking any help. And we thought that it would be particularly important for women because very often they have very busy lives, they might have a limited income, and gender pay gap disparity remains an issue across the world. So we suspect that online strategies and interventions might provide an affordable and inclusive opportunity to empower women to achieve quality of life. So we had some interesting times trying to get this piece of work published. And in fact, we didn't set out to look at it through a mental health lens at all initially. But it turned out that nursing journals around the world said that populations of their readers wouldn't be interested in this topic and that they thought it was a mental health problem. And so we were asked to consider publishing it in a mental health journal, which we've now done. So we're very interested to think of how nursing has framed menopause and as a mental health condition. So we think there are some opportunities to challenge that notion, and we also think there are some opportunities to further develop a prototype to support women in the future. So we've got an international project underway and we're collecting data at the moment to help us to develop a prototype that might be able to support women through menopause. So that's one digital intervention that can support wellbeing. I also wanted to talk to you a little bit about enhancing recovery. And so very recently, we've had another paper accepted, and it's not quite published yet, so you'll have to bear with us, but it has been accepted in the International Journal of Mental Health Nursing. And this study was conducted in Denmark with one of our PhD students, Lonna Fisker Christensen. And she did a study that looked at video conferencing or teleconferencing with older people with anxiety and depression. And in that study, we were able to determine 3 main themes. And those themes were around patients and providers, and they do experience some technical challenges, as you might imagine. And the second theme that we discovered was the use of video conferencing can be a supportive clinical technology. And the final theme was around face-to-face versus video conferencing, and developing that therapeutic relationship that is necessary. So the conclusions around this study were very closely linked to that the experiences people had were linked to sentiment, expectation, opinions, and attitudes. And even though, so we conducted home visits with older people with depression and anxiety in a couple of settings in Denmark. And we offered them either face-to-face, where a nurse would come and visit and administer treatment for depression and anxiety, or in some cases, people were willing to trial the video conferencing. And we found where people had a positive sentiment and an expectation that it might work, and an attitude that was positive, that they had a very positive experience. And they found it to be just as good as a face-to-face interaction. So one of the really interesting things we found was that there is a sense sometimes among nurses and staff that older people mightn't be able to use the technology, or be willing to, or have a sentiment that they would be prepared to. Well, this study found that actually the patient population were very interested and had a very good attitude about it actually being effective and working. But some of the professional staff, nurses, certainly felt that they needed more support in terms of being able to deliver using the technology. And one of the key things was that they didn't feel familiar enough with the technology, and because of that, it interrupted the communication strategy that they had. And so some of the staff had more trouble than, in fact, the patients. So that leads us to thinking about clinical practice. So we do need to support our clinicians with the clinical skills they're going to need. We need to build workforce that has the communication skills and the therapeutic skills to be able to successfully utilise digital technologies. So that's a real challenge for our workforce right around the world. So that study was done in Denmark and suggests that older people are very interested to be using digital technologies. And then finally, I want to very briefly talk to you a little bit about promoting precision treatment. And I think this is a work in progress here in Australia, a large work in progress where we have considered the needs of the Australian population in regard to COVID-19, and we have devised a program of research that is a transition to a new normal. We're designing and developing and trialling a personalised mental, emotional and social health digital intervention to promote resilience for people with new or pre-existing mild to moderate depression and anxiety conditions related to COVID-19 adversities. And so we're actually bringing together three areas that sometimes we don't see together in an intervention. We're looking at mental health. We've got an arm of this study that is dealing with infection prevention and control, and we're using a disaster health model as well. So we're bringing together those three areas and developing a novel intervention. And I won't have time to go into a great deal of information, but you'll see on the slides when you do get to see them, some of the things that we're aiming to do there. So we'll be developing an intervention to build resilience, and we'll be using drawing on human-computer interactions and computing design theories to design an experience that can be precisely administered to individuals. And in order to implement it, we'll be using normalization process theory. And so we will be we'll be developing an intervention that is able to offer some acknowledgement of the emotional responses and feelings that are triggered by COVID-19 related disruptions to usual and familiar life work patterns. And I guess that is one of the key things that we see an interruption about. Again, what is familiar, and some distress arises where familiar is lost. We'll be doing some assessment around any personal threats, whether they're physical, psychological or spiritual, that might be posed by COVID-19. And we'll be developing within this digital platform ways to mitigate the discomforts that arise for people. And some of that will be mitigated using ecological conditions and represented by biophilia, nature. And we'll also be looking through the lens of grief and loss, represented by solastalgia. So a grief and loss that is associated with something, a place you can't go back to, which is very relevant to COVID-19 and the way we have to change behaviour for an unknown period of time. And then we hope to develop this, this new intervention tool to construct a new normal, so that we can assist people with the building blocks to establish a new sense of familiar and a usual or routine in life patterns. And we hope that this will help in developing some resilience and can be deployed rapidly through administration through a digital platform. So that is a work in progress, and it will be able to be deployed in a way that is able to be precise to an individual's needs. So there are three very quick and brief examples of digital interventions and research that's been conducted very recently about enhancing recovery and promoting precision treatment and supporting wellbeing. And so we've had examples that have looked at supporting women in menopause, supporting older people with depression and anxiety through video conferencing, and developing a very precise tool to assist people with depression and anxiety related to COVID-19. And with that, I will say thank you very much and hand back to Maria for the next speaker. Thank you very much.